In a world where Big Pharma writes the script, it's time to believe. Biohack. Become.
We're here to explore the truth about healing that exists outside the broken medical system, to give you the knowledge, the community, and the strategies you need to become the hero of your own health story.
Your guide is a biohacking entrepreneur, a near-death survivor, and a cancer warrior, navigating his own healing journey. Founder of BiohackingVille, Exodus Strong and QE Strong. Your host, Rob Rene.
Hey, welcome to another edition of the BiohackingVille Podcast. Today is a really exciting one. I've got Dr. Allesandro Porcello here with us today from Tijuana, and he's got an amazing facility down there. I've actually been in the facility multiple times. They've done a lot of work for me, and they're really transforming people's health in a major way. So, Doctor, thank you so much for being here on the show with me today.
Thank you so much for having me, Rob. It's a pleasure. As the clinic's been there, we're trying to get the message out, and we're loving to have this interaction with you and getting the message out to your followers.
Yeah, it's going to be a lot of fun because what you guys have done for my health, as well as what I know you've done for lots and lots of others, is very exciting. So I'm very interested in how you got started. So I'd love to have people learn more about you and what you're doing and how you're doing it, and then how did this whole center come about?
Yeah, I'll start a little bit with the clinic first because that's been around for 26 years now. We're going actually on 27 next year, I believe. But yeah, the clinic originally started as just a dental clinic. My father was actually the one that kind of started with that. My dad had a background in managing some medical clinics in what was LA, Orange County area in the 70s and 80s, and just conventional medical at that point. Then he did a few other things. Then he decided to go back, but he decided to go into dental just out of a series of events in his life that kind of led him down that path. And pretty shortly after that, he realized that the conventional dental wasn't really what he wanted to do. And he's not a dentist, he's the businessman. But we had one of our first patients within the first few months mention holistic dentistry. So that's actually what my dad took him down the path of alternative or integrative medicine. Was he gathered all the information at that time. I'm talking about 1999, around that.
Wow, well, that's awesome. Way back then, that's great.
Yeah. It was not as well known as it is right now. And even now, especially in the dental side, it's still a newer concept for a lot of people.
That's true.
But he had the pleasure of meeting Dr. Hal Huggins, who is one of the fathers of holistic dentistry, and got to take our dental director, who's actually still with us, to Colorado to do his trainings. And we got certified with them. And then we actually became one of the 2 clinics outside of the US where Dr. Huggins would send his patients for holistic dental work.
That's awesome.
That's how we started in that holistic field. As the dental clinic grew, we added more dentists, we started training more people, we started, over the years, we put our own dental lab so that we can make sure we're using the right materials that are biocompatible. And as that expanded, we started working with medical doctors, but always externally, and we would just refer our patients to them. And over kind of the years, more and more patients kept asking us for us to do more medical things there. They're already getting mercury metal fillings removed. Why can't we do chelation? And we were already using vitamin C IVs. Why couldn't we do other IVs? So at about maybe around 14, 15 years ago, we started adding some medical, originally as a support for the dental. And then the medical really started expanding. Right now, 15 years after we added medical, the clinic is really essentially 2 clinics combined. We have the dental with 7 dentists working right now with our own lab. And then we have the medical where we have medical doctors, nurses. We do everything from IV therapies, hyperbaric, red light therapies. We do PRP. We do some aesthetics and things like that. But really focus in the integrative health. The 2 big specialties that we have in the medical area, one is regenerative medicine. We have our own lab with stem cells where we produce our own stem cells. We're one of the few authorized centers in all of Mexico to have our own lab and be able to use them for clinical use.
Awesome.
So we do a lot of amazing things with regenerative medicine, chronic illness, anti-aging prevention. And then the other side is the integrative oncology, which is the cancer treatments we've been working with, where we handle some of the treatments ourselves, but we also work with 2 other specialists for specialized treatments, all in coordination in the clinic. And that's really been what's been expanding, because unfortunately we get a lot of patients that have gone through a lot of things in the US or in Canada, and the conventional oncology only gets them so far, so limited.
Right.
And the beautiful thing that we do is we're not opposed to conventional, so we can adjust our plans to what you're doing back home, or if you just want to do a full treatment with us and us have manage everything, we can do that too. And at the same time, if we need to use a little bit of radiation or a little bit of chemo, it's all done in conjunction with the integrative side and the alternative medicine. And obviously we focus on a lot more things than your normal oncologist does.
Right.
So that kind of actually leads me into a little bit of my background just quickly.
Yeah, this is great. This is so exciting. I was going to say, so how did you get started? Your dad obviously started at number 20, almost 30, or probably longer than that.
26. The clinic itself, 26 years.
You said.
We're going on 27, so we're right now 26.
Okay, gotcha.
Funny story, my major was actually psychology, and
Okay.
Debating going into grad school and doing a PhD in psychology. And I love psychology, but I wasn't sure if I wanted to be a psychologist. And I said, you know what? Before I commit like another 6 years of research and graduate programs, let me take a year off. And originally I went to help my dad. I grew up around the clinic.
Yeah, I can imagine.
But I went to actually work there full time, supposedly for a year, while I figured out exactly what
That was going to be your gap year, as they call it.
It was a gap year after college, and I ended up loving what we were doing. At that point, we still had not brought in the medical. That was the year we started bringing in like a doctor to see patients
Neat.
for like little things for IVs or for like little plasma treatments for the face. So I got to experience that part, and I was actually part of that process of adding the medical and then getting the medical growing on a more administrative side though.
Okay.
And then I ended up staying for 7-8 years afterwards instead of the 1 year I was planning to. During that time, we really expanded the clinic, our services. I got exposed to the more medical side, ended up loving it. And I was debating going back to school. I always wanted to go back to school, but now I was like, instead of going for psychology, I found more what I wanted to do. And I was thinking, should I go the MD route? Should I go another route? And in that kind of conversation that I was having with myself, one of our patients at the clinic was a naturopathic doctor from Seattle. And she was the one that told me about the naturopathic doctor program. A licensed naturopathic doctor goes through 45 years of medical schooling. The difference is we don't see really emergency medicine outside of CPR, suturing, like basic things. But we don't do more in emergency medicine, and we don't do any surgery, like I said, besides little sutures and things like that. But you focus more on psychology, nutrition, botanical medicine, things like homeopathy, a little bit of chiropractic, the spiritual side. You see a lot more. And that was very similar to what we were already doing. That's what I want to do.
There you go. Amazing.
I want to do. I prepped for a year or two. I took some classes since I was psychology. I had to take the pre-med classes I was missing because it is considered a medical school. You do have to have all the biology, chemistry, and everything.
Right.
Went back to school, did my medical program in 4 years, became licensed in California, and then went back to work at the clinic, and now split my time between admin still and seeing patients and working with, for example, my medical director, who is the stem cell specialist, to integrate new programs into the clinic, from expanding our stem cell treatments to we've been expanding the cancer treatments that we do. We've been adding in things lately like peptides. working more integrated programs for some of the treatments that we did. Now we're adding in more modalities to support them, like the hyperbaric oxygen, the red light therapies, and working with a nutritionalist at the clinic. So we've been really expanding that over the last few years that I came back into the clinic.
Super cool.
But
That's
I loved
really
it.
cool.
I loved it.
So how long ago was that? When did you finish your degree?
So I finished the degree about 2.5 years ago, 2 years ago.
Okay.
Yeah. So a little
Nice.
bit more recent. I've been at the clinic, like I said, for 15 years.
Congratulations for going, because that's a lot of work and a lot of effort to do that, right?
Yeah. And then, what really helped was a lot of stuff that we were already doing at the clinic. I was already familiar with it in school.
Yeah.
A lot of the IV therapies, a lot of the treatments.
You
I
had a
didn't
leg
see
up
it.
on most of the students, right? Because you've been doing it for years.
Yeah. I hadn't seen the clinical as the doctor, but it was easier to learn it and incorporate it having a background.
Yeah, that's awesome. So let's talk about the clinic a little bit. So one of the fun things for me was I got introduced to you guys through a practitioner or holistic practitioner in Dallas. And I got diagnosed with melanoma. And one of the first things, when my intake with him went through my whole past and what could be causing what happened and trying to just evaluate my entire life. And we went through, and one of the questions he asked, what I thought was really strange at the time, was, how's your mouth? I'm like, what do you mean, my mouth? I'm not talking about my mouth. I'm talking about my melanoma, right? And so as he started asking me, he's like, do you have any mercury in your mouth? And I said, yes, I think I've got a couple of metal things in my mouth. And he's like, how many root canals do you have? I'm like, I've got a number of root canals. And he's like, that's the first thing we need to fix. I'm like, what are you talking about? Because I didn't have any knowledge of that and why. And so that was really eye-opening for me. And so I just dove in. I said, okay, I'm going to fight this thing. I'm going to win this battle no matter what. And just as a side note, I am winning that battle, and it's going to be amazing. Yeah. But the fun thing is, he sent me down to your facility. And so I went down, and they got rid of the mercury in my mouth and did an amazing job. I think Rene, if I remember right, because my last name's Rene, so I remember he was just an amazing man. Your whole team was just absolutely phenomenal. So I want to just congratulate you for the care that they take with people, and what they did to my mouth in 3 days was absolutely phenomenal. It was like just 2 days of actual work, but they did 16 things in my mouth in a 2-day period. And there was a number of IVs that were associated with that to help me recover. And man, I got through that process, and I went home, I flew home the next day. And it was like, how is that possible? I can get that much work done and my mouth not be this big. And it was like, it was incredible. So I want to just thank you for that. But then also I want to educate people. This is so amazing. I watched, I don't know if I'm sure you've seen or heard about the documentary called The Root Cause. Have you heard that? And that I literally had a friend send that to me as I was on my way down to your facility. And I was just like, thank God I'm going down to the facility after I watched that. So that I want to just put that as a bug in everybody's ear. Go watch the documentary, The Root Cause, and then you'll start understanding from a dental perspective how important it is to fix the mercury in your mouth and the root canals in your mouth. And that's why the people at American Biodental Center, part of the holistic care facility, is an amazing part of that. And then I'm also super excited to talk to you about what you're doing from an integrative oncology perspective, right? Because that's a very passionate area for me. And BiohackingVille, we're really trying to document as much as we can about integrative oncology, because the standard of care in the United States is really, in my opinion, just below standard, right? You look at all the other places across the world, and I think they're more advanced from a cancer perspective than we are in the States. And so I met with a number of doctors here with my personal situation, and the situation was there's a protocol, and it's called the standard of care, and they literally have to follow the standard of care. That's the only thing they can do for you is the standard of care. If they go outside of that, then they can be sued for malpractice. So it just doesn't make any logical sense to me how that works. So if the standard of care doesn't match with what your particular cancer problem is, because they're all, as I'm learning more about cancer, they're all different. Every type of cancer is way different, and the reason you get that type of cancer is way different than the reason you get another type of cancer. It's like saying you get sick with something. It's like you could get sick from a million different things. And cancer is kind of that way. Is to me that the more I learn, is every single cancer is different, and every single person who gets a different type of cancer is different. So you can't treat everybody the same way. And unfortunately, in the United States, we treat everybody the same way. We put them all in the same bucket and we say, here's your standard of care. Yeah. And so it's not as simple as that. But at the same point, it's just interesting. So I am super fascinated about your integrative oncology work that you do and how you help people and how you individualize the care based upon the type of cancer and the type of person, and then just the modalities and things that you are doing are fascinating. Let's talk about that for a second. So do you want to go back up to, I said a lot about the dental piece. Do you want to talk about dental for a minute, and then we'll jump into integrative oncology? How's that sound?
That sounds good, because it's funny you mentioned the movie or the documentary Root Cause, because we know some of the doctors that were on there because they were from the era that I mentioned of Dr. Hal Huggins and those early trainings that especially my dad and our dental director did. They met a lot of those doctors, and
awesome.
It's not a new concept, but unfortunately it was very suppressed.
It's suppressed, isn't it? In a big way, right?
Yeah.
Most dentists have no idea.
Yeah, and that's the thing. It's not like this super grand conspiracy that all the dentists are involved in it, but they're not trained that way. And the same thing with medical school and a lot of medical things. They're trained to think of a certain way. They're taught that, and maybe not now with the mercury is something that now it's been phased out for the most extent.
Thank goodness. Yeah.
But if you look at the Dental Association guidelines for mercury, now they just put, hey, we don't recommend it for kids and pregnant women. Maybe it's not a good idea. And you're like, it's still one of the most toxic materials out there in existence.
Exactly. There's a reason why only certain people in the United States will actually do any of that work, right? Because they don't want to touch it. They're like, no, I don't think so. And then if you get a center here in the States to try to do mercury removal, it's really expensive. It's wow. So it's a big problem. That's why it's so exciting with what you guys do. Is I think you do it in such a less expensive manner from a cost perspective, but you do it professionally, right? And you guys are very good at it. So you're very experienced and you do it really safe and really well. That's one thing I want to just tell people right up front is a lot of people are scared. A lot of people are scared of Tijuana, right? They're scared of Mexico. I'm going to go to Mexico and get help with my health. And it was the safest trip I've made. I had a wonderful driver pick me up in San Diego and took me to the facility. I stayed at an amazing hotel that's connected to the center, and the facility's within literally hallway walking distance of the center. And I got my care, and then I was able to just stay within that hotel. Just fantastic. I don't know if it's a 5-star, it's a 4, at least it's a very nice hotel. Yeah. And the facility was amazing. So anyway, it was very safe, and the team was awesome. So anyway, continue. Don't mean to interrupt.
And thank you for mentioning that, because a lot of people don't realize that Tijuana is like the #1 destination for medical tourism.
Yeah, that's amazing. I don't think people realize that. So we need to amplify that. We need to let people know that it is safe. It's close to San Diego. It's a quick drive down. And the medical area is amazing, right?
Yeah, I live in San Diego. I go back and forth every day. All of our patients, 99% of our patients for those 26 years we've been around are international, especially Americans and Canadians. And we're not the only clinic like that. Most clinics in the area obviously do more like bariatric and weight loss and conventional dentistry and things like that. But in our area, there's some of the top world clinics for all types of therapies that have been around for years. And a lot of people don't realize that. A lot of people think, oh my God, I'm going to go to Tijuana for medical. That's so weird. It's like, no, the city lives off of that, to be honest. It's like a big part of the market there. But anyways, going back, so mercury fillings is one part. Obviously, it's a neurotoxin. It causes a lot of issues. It's important to remove it properly, because in removing mercury, just by drilling it, you actually heat it up and you actually release more vapors and you break it up more to where it becomes more dangerous. When you remove mercury, that's where we're following the holistic protocols. Your mouth is covered. It's called a rubber dam. It covers everything. It just has those teeth exposed. We use oxygen. You have oxygen. We use a little thing. We call it the elephant trunk, because like a little vacuum that looks like an elephant trunk suctions up. We have ionizers, the type of drill that's used, the way you drill it out without it heating too much. the vitamin C IV that we give you. It's all in combination to protect not just you, but our doctors. Because actually, for example, Dr. Hal Huggins, who was the pioneer and mentioned about this, the reason he found out about this was because he started having health issues and he realized putting and taking out all this mercury.
Right.
So,
oh, interesting.
yeah, the doctors
Getting mercury exposure.
Yeah, the doctors and the staff were being exposed to it, and some even contribute the the high suicide rate amongst the dental profession, especially years back, might have been associated with that because they were so exposed to that mercury they were working and putting and removing and putting and removing multiple times throughout the day. Right. So that's a big thing that you want to make sure that not only do you have it removed, but you have it removed properly. And then what you're getting replaced with, a lot of people think, oh, I got this ceramic crown or I got this white composite. It looks natural. It's good. And not always. A lot of those materials have high aluminum in them or have other metals. They have high levels of BPA plastics. So you have to make sure that the doctor you're working with is using the composites and the ceramics and the porcelains that are as free of that as they can be and are compatible with the body. And that's what we've specialized in over the years. And the other part, there's so many other things that are considered the silent killers in dental. You mentioned the root canals. That's getting a little bit more, people are becoming a little bit more informed about it. There's still a lot of pushback, obviously, from the conventional world that no, they're completely safe. And I won't even get to debating that. I'm just going to say a tooth is an organ, right? So it has different types of tissues that work together to form it. It has its blood supply, it has nerve supply. So when you do a root canal on a tooth, what you're doing is you're going into the tooth and drilling out the blood and nerve vessels, usually to get through the tooth to the infection at the roots. And then you pack it in with this material and you put a crown over it. That's the typical process of a root canal. What ends up happening is you just kill the tooth, right? And the issue here, this is another side point, but a lot of times doctors recommend root canals when they're not needed. For example, I know someone that wanted to do a little bit of aesthetic work on her front teeth and do veneers, which is just completely cosmetic. The doctor did 4 root canals on the healthy teeth just to do the veneers. You can do veneers without doing that. There's no reason why you need it, especially in her case, she really didn't need it. She had no infections. The teeth were in good shape. She just wanted to make them cosmetically a little bit more pleasing, right? But that a lot. Or there's a cavity and the doctor, instead of taking the time to try to save the tooth, just goes straight to the root canal and does a crown. And again, maybe because they don't see it as bad because they've been taught, oh, it's normal and you're not going to have pain. Yeah, the tooth is dead. You can't have pain on a dead tooth. But the thing is, the moment you kill the tooth, it starts decaying. So just common sense. You have an organ that's still attached to your body that's not receiving nerve signals, and it's not receiving blood supply. And at the same time, it can't get rid of the waste because the blood supply is removed. It starts decaying. And any dentist can tell you an old root canal is going to get reinfected and has to be redone a couple times before you have to get it out. Or it's going to get brittled from being necrotic and crack. Those are the 2 routes root canals can go. Can it be in 6 months or in 16 years? It's hard to tell. There's a lot of factors there, but that's the way it goes. It's really the only kind of thing in medicine or dental that leaves a dead organ in your body. Every time something dies, you cut it off, you burn it off, you freeze it off, but you don't leave. If you have a dead finger, the doctor never says, just leave it on there and just paint it every day so it looks natural. And
instead of looking black, it just looks, it looks right.
Yeah. It goes straight to, we got to amputate it. And you know what? We might have to amputate even around it just as a prevention, as a precaution. But they don't follow the same thing for dental, right? So as that tooth decays, you have bacteria that forms. And the mouth is full of bacteria. And the mouth bacteria is now linked to heart disease. It's linked to autoimmune issues. It's linked to, with COVID and everything, we saw that essentially the microbiome of your lungs is very connected to the microbiome of your mouth. So you have that. You have those toxins that are released by that bacteria, and they go systemically. Right.
And one of the things I found fascinating that really goes along with this that I didn't know prior to my research was that your mouth is connected to every organ in your body, right? So it's like you can have something on your ankle and it could have derived from bacteria from my mouth. Your teeth are literally connected to all different areas of your body. And I had no idea. So that's fascinating. If you have this dead thing inside your body and it's got bacteria growing in it, you're not going to know because your body isn't going to be telling you because there's no blood, so it is dead. But this bacteria could still be there. It doesn't mean that your mouth is swollen. It could just still be in there, and it still could be affecting something totally away from your mouth. And you're getting a problem in your ankle that literally could be derived from your mouth. And you would never correlate those two without having this understanding.
And a lot of people say that. They say that tooth doesn't hurt. Obviously, there's no nerve in it. And in fact, when you start feeling pain, it means that what's essentially coming out of that tooth is already affecting enough of the surrounding tissue to where your body is reacting and feeling the pain. And the thing is, some people get root canals, and to be honest, they don't really have any changes to their health, sometimes for years and years. But we've seen a lot of people do, and a lot of people start having these little inflammatory conditions as the first sign. That connection we see a lot, even before we had the medical side. Our clinic used to work with a lot of the cancer clinics in our area that were doing integrative oncology, and some of them wouldn't even start the cancer treatments until we saw the patients and did the dental. And we have that chart. It's actually a meridian chart of which teeth is connected to which organ or which part of the body. And a lot of times in cancer, you do see that connection. And it's hard to say, it's not that this tooth caused it, but there's definitely like a relationship, and it's a two-way street. But where we did see it a lot, and you can ask any doctor that works holistically with dental and cancer, is breast cancer. Huge correlation between the teeth that is related to the right breast or left breast and having a root canal or an infection there or some sort of issue.
That's fascinating.
Saw that even before we talked to other people about that. We saw that, and then we started learning from other doctors the same thing. So it's very important that what we do at our facility in those cases, first we try to save the tooth. A lot of times those people that come in with root canals recommended, we can actually save the tooth first. Other times, unfortunately, the tooth is too far gone, or the infection's already too big, or it's already affected part of the tooth where we can't. In our recommendation, we do an extraction. And if you have an old root canal, it's the same process. We take out the old dead tooth, we go in, we clean out all that infected tissue and bone around it until it's only healthy tissue. We put ozone in the area. Ozone is a gas that helps, one, kill bacteria, and then two, it helps to actually ozonate or oxygenate the tissue around it so it heals better. We do plasma, so PRP, PRF, which is derived from your own plasma. It's the healing portion of the blood. We pack it in there. It turns into a little gel. We pack it in there and suture it up. That helps heal the bone and the tissue. We also do an IV of vitamin C. And then you have, depending on the teeth and your situation, you have options of like removable partials, permanent bridges, or zirconium implants down the line. But by doing that, that's where you like you said, you felt so good after, because we're doing this whole combination together to reduce the pain, the swelling, the risk of getting something like a dry socket later on while you're healing. It can be very painful. We have a dentist that I never forget. He says that when he started working with us, when we taught him our protocols, he was like, this is weird. Like, why am I going to do this? But fine, I'll do it. And then he started noticing the results, and he said he noticed it because he would do these major surgeries with us at the clinic, and he would remove 12 teeth or like infections and put the ozone, the plasma, the vitamin C, and the next day the patient would return the pain medication, was like, oh yeah, I didn't need to take it. And then he would go with his church on Sundays to do community service or community help for the church program that they had. And he says he would take out like one tooth, and obviously because it was pro bono, they didn't have access to the plasma, the ozone, the vitamin C. But he would just remove that tooth, clean and suture it, and then the patient would return swollen with a lot of pain. And he's like, how did I take one tooth? And he has that results, but then over here at the clinic, I'm doing these major surgeries, major infections, and the patient looks like he's not even swollen at all.
Yeah.
And that's the difference in the care.
I was blown away. I literally was. I was like, there's no, I'm going to be, I thought I was going to walk out like this with this
Yeah.
great huge head. Because I'm like, they just did so many things to my mouth in such a short period of time. And I was walking around the San Diego airport recording myself going, how am I able to do this? This is crazy. I just 2 days ago or yesterday, I was in major dental surgery. And here I am talking and walking, and you couldn't even tell.
Yeah.
Just
And
phenomenal.
obviously there you still have to take precautions and everything, but it's a big difference in how you feel.
Yeah.
So that's our standard for all types of extractions, but especially when we're removing things like the root canals where there's usually an old, like, infected tissue there.
Right.
We do the same thing with cavitations. That's a whole other thing that can be related to obviously your health and especially
Yeah, explain
cancer.
cavitations to people. I didn't know what it was before I got mine fixed. So
And
explain it.
that's something that's still becoming a little bit more well known. Essentially, a cavitation is when you've had a tooth extracted at one point. It's pretty common to not clean out like the old ligaments and go in and really clean out everything. Unfortunately, a lot of places just do quick little cleanup and give you antibiotics and you go on your way. The thing is, if any of the ligament remains or any of that infected tissue remains, as the area heals, it encapsulates it and you get a little pocket of infection in there. And then over the years, that infection spreads as it eats away at the bone. The thing is, cavitations are not painful. Most people live their whole lives with a cavitation without even realizing it. And it's just you have dead bone in that area and obviously bacteria and toxins that form from there. And they're very hard to spot. Your traditional kind of 2D x-ray that's taken like panoramic, you can see it when it's bigger. If it's smaller, a lot of times you don't see it. Sometimes it just looks like the bone is deformed a little bit, usually because it's where you've had a tooth extracted. And it's very popular like in the wisdom teeth, for example, because they're all the way in the back.
Right.
Your dentist just sees it and just says, oh, that's just how the bone healed after the surgery. But you actually have to go in, you have to do a 3D x-ray to see the density of the bone, the layers, and you actually have to remove and essentially dig all that out and then put the ozone, the plasma, and let it heal. That's actually why when we do the extraction, especially of the root canals, we clean that whole tissue until only healthy tissue remains before we do the ozone and the plasma. It's to reduce the risks of cavitations going on.
So fascinating.
Yeah, and those are considered like the three biggest health issues are the cavitations, the dead bone, the root canals, and the metal, especially the mercury metals. Those are the biggest health issues in the dental side.
Yeah, that's amazing. And literally, in the 2-day period, they fixed all of mine, right? So they literally got rid of they replaced 4 of my root canals, at least maybe 5, and then four mercury fillings that I'd had, and 5 cavitations. So it was like 16 things I counted that they did in a 2-day period. It was just unbelievable. I'm like, what the heck? I haven't had to do all of that. But anyway, I just so amazed by that whole process. And they fixed all 3 of mine in one trip. So it was absolutely phenomenal. So would have been probably 5x or 6x the cost if I would have tried to do that in the States. Yeah. So just an amazing service. And I think you explained all 3 of those things really well. So I appreciate that because I think it's really important for people to understand how important that is to their health in general. But one of the things that you did mention that I find fascinating is the reason that I was there is because a lot of integrative oncologists realize that it could be a source of the problem. And so they want to fix that first, and then they'll start working on everything else, right? And that's what we did in my case. And right now, I'm super excited because my cancer is shrinking. And so that's the way we want it, right? I want to get myself completely clear of it, and by doing all these things right, I was able to stop it from spreading, and be able to actually I'm working with both the standard of care in the United States and alternative medications and treatments in Mexico as well. So I'm combining both, right? Because I think it's important to do both, and I just find it fascinating. So thank you for going through that. That was super cool.
Yeah.
And I know how much time do you have left? Do you have time to go into the integrative oncology component?
Yeah, of
Awesome.
course.
Let's do that because we can split this segment into two, or we can just do this. But I think it's what I would like to do at some point, just maybe specialize on one area, and we spend a little bit longer. That was awesome on the dental part, so thank you. But let's give the overview of the integrative oncology component of what you do. We could do the same thing on stem cells, right? We could go deep on the
Yeah,
stem
on
cell
the other,
component. Maybe
yeah,
the longevity, we can do another conversation on longevity, but
sure.
for the rest of this segment, let's talk about integrative oncology. And so you help people with their mouth and dental components, but someone comes to you and says, hey, I have maybe breast cancer or something. What do you do and how do you help them from an integrative oncology perspective?
Yeah, of course. Like I mentioned, as an integrative center, we really combine all these different areas. When we get a patient coming in for anything on the oncology cancer side, we still recommend obviously the dental and working on that end too. What we do is, and the beautiful thing about our facility compared to some other places that kind of do cancer treatments is a lot of facilities do, it's essentially like one package that you have, and we have a 3-week program and that's it. And if you just want to do a little bit of supportive things, we don't do it. You have to do the whole program. We don't have that. We essentially have different options that we can do, and we adjust to our patients. So we get patients that are looking for prevention because their family has a high family history of cancers, or they were diagnosed with a positive gene that puts them more at risk, or they lived a lifestyle where they were exposed to a lot of things that could be contributing to them developing it, and they want to prevent it. So we get patients that come in for prevention. We get patients that are currently in chemotherapy, radiation therapies with their oncologist, but their oncologist doesn't want to do anything else, right? They say, I'm just going to do the chemotherapy and that's it. And I'm not touching anything else. And they really want to complement it. So that's something that we can work with also. And then we get people that have already finished their treatments and are in remission, and they just want to support their body, their immune system, to prevent that coming back in. So we have those, and then we have people that come for us that want a cancer treatment with us, a more detailed, complete treatment, and where we manage the whole care. So having that flexibility really opens up a lot of doors for us, because we can do anything from supportive treatments from even a few days, a week, a couple weeks, to really complete treatments where the patient is staying 4 to 6 weeks at our facility and doing like another 4 to 6 weeks at home treatments, where we can really spread it out. We work with a lot of specialists in our area. So we work really routinely. I mean, from everything from cardiologists, gynecologists, etc. But we work with surgeons, we work with internists, we work with also acupuncturists, like I mentioned, nutritionalists, physical therapists. So we really combine all that to what the patient needs. We have access to imaging, so anything from ultrasound, x-rays, PET scans, MRIs. A lot of our patients that we get have already started the process or have already gone through some sort of treatment. That's just in general, even outside of cancer, with our regenerative medicine, even with our dental, that's the case. Because most people, especially in the US, don't think of going to Mexico as a first option. Unfortunately, conventional cancer treatment, which you were mentioning, this is the process we have to follow and we can't deviate. And unfortunately, conventionally, things like chemotherapy and radiation, their main goal is to kill off the cancer. But to do it in a bombard it kind of way. And a lot of times what ends up happening is you're destroying your immune system in the process. You're destroying other tissues or damaging other tissues in the process. With integrative oncology, even when you do have to use radiation and chemotherapy, you're still supporting the body with boosting your immune system, doing it properly though, but boosting your immune system, boosting certain processes that are anti-cancerous, and lowering certain processes that are pro-cancerous while you're going through the whole treatment. We've had some really amazing results. One example is actually one of our own staff that we have a few years back was diagnosed with colon cancer. And it was one of those situations where he had some symptoms and he postponed it a little bit until he noticed something really serious. He went, he got checked, and they found a giant tumor in his intestines. They did colonoscopy, it was mapped, everything, and they essentially told him, hey, we have to remove your whole intestine. We were like, hold up, let's try something first. So for 5 weeks, he went through the treatments. And what we were doing with him, and we were actually working with one of the doctors that I mentioned that we work closely with. We were doing specific IV therapies with him that were done essentially daily, 5 days on, 2 days off for those 5 weeks. But we were doing different types of IVs. We were doing hyperthermia in combination with that. Hyperthermia is a machine where you go in and essentially it covers the whole body with the exception of the head that sticks out, and it heats up the body in a controlled manner.
It up or cools it?
No, it actually heats it up.
Heats it.
In hyperthermia, you're heating up the body, and what happens is cancer cells don't have all the protective mechanisms as healthy cells because of that damage to the DNA and the changes that have gone on to cancer cells. So it works in two ways. One, it throws off the cancer cells' ability to essentially function, reproduce, and protect itself. But in combination with some of the other like IVs that we were doing, it actually helps to speed up and make those treatments more effective. So by boosting that metabolism, you actually kind of speed up the process of how they attack the cancer also.
Yeah,
And
fascinating.
it's obviously it's a whole other subject that you can go in and break down. But in his case, we were actually using what's called IPT, which is a low dose chemotherapy, but you're using essentially insulin and glucose to trick the cancer to absorb that low dose chemotherapy, and it helps to concentrate the chemotherapy into the tumor sites. It kills off the cancer while reducing the damage it does to the rest of the body. And that's one of the things where it works really synergistically with the hyperthermia. So
That's very cool.
yeah, we were doing that. We were doing IVs. We do this with a lot of our cancer patients. We do these. They're essentially called auto vaccines. They're treatments that are done with your own either blood or sometimes even your urine, and it's made in a lab, and they make like injections that are used. We have one that works really well, for example, for prostate issues. We have some that are more for the immune system. So he was doing treatments like that for 5 weeks. At the end of the 5 weeks, he went to his conventional oncologist again, because obviously they were like, hey, you really need to have this done. You need to have this done.
Right.
And they couldn't find the tumor anymore. So they had to do a new colonoscopy. The tumor, and we even have the before and afters of this, the tumor is gone. They found the spot where the origin of the tumor was at. And as a precaution, that's the only thing they surgically removed.
Wow.
So they didn't have to remove the whole intestine. They just removed a few inches of the intestine right there where the source of that tumor was as a precaution. Even the the surgeons were completely surprised that the person that was laying next to him in the hospital had essentially the same thing done or something similar done, and she couldn't get up and walk for a week. And the next day he was walking around the hospital floor like nothing had happened. His immune system was strong. He was strong. Post-surgery, he made amazing recovery. And it's really amazing. So even where the oncologist, the surgeon that did the procedure, she was very against him holding it off while we did the treatments. And at the end, she even had to admit, like, okay, whatever you guys did worked. Yeah, and like that, we've had other amazing stories. We have one too that a professor of mine from when I was in school referred us a patient. She was doing some of the treatments back home, but wanted more supportive treatments. Already had metastasis from breast cancer into the bones and different tissues.
Oh, no.
A year and a half later that we started treatment with her, right now she just goes in like once a month, once every 2 months, just to get some maintenance IVs, but she is 96% in remission. The last time I did a scan on her, and she looks stronger, she looks healthier, she looks happier.
Yeah. And she had breast cancer in the bones even, huh? So that's that's an advanced stage, right? Wouldn't that be considered stage 4?
Yeah, that's when it starts getting to. That's actually the reason why they referred it to us, or he referred it to us, because he was like, "There's nothing else I can do."
Right.
Point.
That's
So,
awesome.
so
Love that story.
So we have some cases like that. We have other cases where again they're not that severe, but they were in the early stages. They had something that was precancerous or at risk, and you can, especially when you catch it at that level, you don't have to do sometimes even that high of a intervention, and you
Right.
can get really amazing results. One of the things that we do at our facility, which works really well in combination with all these other treatments, and again we can go down that rabbit hole another time, but it's dendritic cells. So those are different from stem cells. Dendritic cells are made from your own blood, and then they get taken to our lab, and our biochemist essentially has to separate them out, reprogram them a little bit, and then you can use that as treatments. And those are your own essentially immune cells, just reprogrammed to attack specifically the cancers, and obviously concentrated in a form that is very effective. When you combine that with things like the hyperthermia, the other IVs that we do, they give you really amazing results. And that's our big thing with our clinic is we combine, we make a personalized plan for you, and we start working with
Okay.
you.
Okay.
And then meanwhile we're checking to see how you're reacting to it, how your blood work is coming up, what imaging is showing us. Everything we guide with imaging. So if we see that the tumor is regressing and it's going away, we see your blood work, your lab work is getting better, then we continue. If we see that it's not working or something is causing some sort of reaction, then we change the plan. If we see, hey, you know what, this isn't really working for them, let's see how we can modify it, or let's see what we can add in, or maybe we have to use a different type of. All of that we take into consideration while the treatment is going, so that you are getting the best results, and you're not just doing essentially one standard protocol for all types of cancers, which is unfortunately what in a lot of places.
Let's spend just a couple minutes on that dendritic process, because that's fascinating to me. So what would your protocol be for someone that you are doing the dendritic process for? Because you said you had to get either blood from them, or how else do you get the sample to start that process?
Yeah, so essentially the patient comes in. We obviously are doing other treatments during this process. For some people, they stay with us for a week or a few weeks, start the process. Sometimes they go back home and then they come back a few weeks or a month later and then do the second part. But essentially for the dendritic cells, we need a blood sample. From that blood sample, it's sent to the lab. And it's not just like one little tube. We do have to take a few milliliters of blood there.
Right.
But it gets sent to the lab. And then that's where the scientist essentially separates out the dendritic cells from all the other cells in your blood, and then starts essentially to, the easiest way I can explain this is to train the dendritic cells to go after, or prime it to go after the cancer cells. And then from there, they also cultivate it so that they expand to a higher concentration. That whole process takes about 21 days, so about 3 weeks. You can't really speed it up, so unfortunately, that is what that takes. But again, I should say unfortunately, because during those 3 weeks, usually our patients are still receiving other treatments, they're doing other things. We also do, like I mentioned, at-home treatments where once they finish certain things and the patient goes back, we can recommend supplements or things like those auto vaccines I mentioned that are made from the patient. Those are things the patient can apply at home by themselves. They don't have to be in the clinic for that. The patient they're still working on themselves, they're still receiving treatments while the dendritic cells are prepped, and then they come in specifically for those treatments.
Okay, so then let's say you're going to do the actual dendritic treatment itself. What do you do? How do you get it back into their body? And then what is the protocol when you do it? Do you do it every month, every 2 weeks, every week, every day? What do you do with that process?
So essentially it gets prepped back as an IV. So you receive, and it depends on the different types of cancers, obviously in protocols, but usually with one dose or one sample, you make 3 doses. So you receive essentially 3 times those dendritic cells. Those sometimes are spread out over a few days. Sometimes they're spread out like one a week for 3 weeks. That is just at that point, like at the discretion of the doctor and who he's treating. But again, while you're getting that, you're also doing things like the hyperthermia, the IB therapies, the other therapies that we're doing in the
In
clinic.
conjunction with that?
Uh-huh.
Yeah. That's
Yeah,
fascinating.
and again, usually people that are doing the dendritic cells, we're essentially doing a whole protocol with them. So they're already going to be with us for a few weeks, or they're going to be going back and forth and coming pretty often while they're in that active treatment phase. They go into more the secondary or the at-home phase.
Very cool. This is super exciting. I appreciate you taking so much time. I know we've already taken a lot of your time, so I want to thank you for that. And I really appreciate what you do as a business. And I would love to invite you back because there are so many things that we can talk about, right? We could have a show on the dendritic process. We could have a show on what you do for breast cancer. We could have a show on what you do for melanoma. We could have a show. So I don't want to take up a lot of your time, but I do want to help amplify the message that doing medical tourism, if that's what you want to call it, or medical tourism in Tijuana, and especially the Holistic Care Center, is amazing. It's safe, and they have an awesome program to help complement what you may have already been doing. And they even like the woman with breast cancer, right? She was at a very advanced stage, and they were able to help her, and now she's living a vibrant, healthy life. And so I think that they can do that for you. So if you listen to this and people who need help, contact me, right? BiohackingVille.com. Connect with me and send me a note, and I'll make sure that we get you connected to Alessandro and the team, and we can get you some help, right? If you need help with your dental work, right, we can do that as well, and I can walk through you everything that they did for me, and I can get you down to the team to help you as well. So again, Alessandro, thank you so much. I really appreciate what you do and appreciate you taking the time. And any last words you have for the group?
No, I want to say thank you for having me on. And like I said, we're open to helping out everyone in any way that we can. Dental is one way, the cancer is another. There's so much we haven't even talked, like the stem cells, which is...
Yeah, that's right. We can have an whole show on stem cells. Right?
It's not used in cancer. That's actually one of the contraindications. But for all these other conditions and regeneration, prevention, so many things. And again, our big thing is being able to help everyone. So we make things affordable. It's why we stay in Mexico. We make it affordable, but giving you the best quality. And unfortunately, in most of the medical tourism areas, a lot of what you find is things that are people that are not specialists in that area, that are trying to make a quick buck or just do really amazing marketing. They're not the best. So you really want to do the research in there. There's a few places around us that are amazing, but there's also a lot of places you want to be careful with. I always say go with someone that's already been there and had the experience and can tell you. But with us, we try to make the whole process as easy and as possible. Everything from picking you up in San Diego, we're 10 minutes across the border in a nice hotel. Our staff speaks English. The easiest way is usually you just send us even an email with any medical information or dental information, x-rays that you have and you want us to review. That first initial, like us just review and put it together, there's no charge for that. Just send it, we review it, and then we reach out to you, and then we can see what options we have and work with you depending on your time and budget. And we're pretty flexible in that end, but we want to give you the best results. So we're happy to work with Rob and everyone in that sense.
Very good. I love it. Thank you so much for taking the time. Thank you, your dad, for leading the way, and thank you for taking the initiative to continue it on and the things that you're doing with that center. It's amazing. Thank Rene. Thank Roman, who helped me a lot. The team there was fantastic. So again, appreciate you, but we're signing off from the BiohackingVille Podcast.
Thank you.
Remember, if you have air in your lungs today, God has a plan for your life. Believe, biohack, become.
Don't forget to subscribe so you never miss an episode. Join the community and get the show notes at biohackingville.com. Follow us on all social media platforms at BiohackingVille. Until next time, believe, biohack, become.